And talk to us about, let's go back to 2013, actually 2001, when the managing entities were first envisioned. But talk about the work that you did in 2013. I mean, that was really very groundbreaking for the state of Florida. And so many of the systems that you put in place are still in place today and used throughout the state. I mean, really, really exciting to have our home managing entity be the one that's really leading the way.
Sure. Some of the stuff I do is not all that exciting. And so having opportunities to kind of reflect back and think about how far we've come in the delivery of behavioral health services is really an honor, because the state as a whole has come so far. When services are provided directly under a government oversight, through their procurement policies, through the requirements on Florida statute, a lot of things take a long time to develop.
Right.
So one of the big advances, I think, is in having outsourced to the community the funding. So all of our public health, behavioral health funding, like our federal block grants, our general revenues, some local grants, all of that flows through the managing entities. And what we're able to do is really implement that in the way that the local community needs. And we can do it on a dime. So we can respond quickly to changes. We can redirect funding. And so one of the big successes is our ability to make sure we maximize the funding that's available. And that's not always that interesting, but it's really important, because you want taxpayers to have faith in the people who are empowered to spend their money. And so we take that very serious. And so blending our stewardship and the needs of our local community really makes the managing entities a really dynamic and flexible way to deliver public health services.